prowazeki. When you think of prowazeki, I want you to think of pro football players, because this scene takes place at a boot camp for football players. So there's a lot of commonalities with the other rickettsia videos. We're going to highlight some here. And just like the other videos, again, we're inside of a stadium for obligate intracellular. And the crowd is all dressed in white to denote the poor gram-staining ability of rickettsia prowazeki. Additionally, we'll have our co-A coach on the side with a bottle of NAD energy. And lastly, you can still see this ad for Ricketts tires for doxycycline, which is the treatment for rickettsia prowazeki. Now let's get more specific. On the right, the coach has a board up for a football play. The play he's pointing to has all the players start in the middle and spread outwards. This is supposed to represent how the rash moves in relation to the body. It starts in the middle of the body at the trunk and moves outwards towards the extremities. It's not exactly the best football play I've seen. Not quite sure what the formation is here, but I never said Team Prowazeki won many games. Now check out our players' uniforms. You see that the players are dressed in red except for their helmets, gloves, and shoes. This is to represent that the rash from prowazeki spares the hands, feet, and head. And who's at risk for prowazeki infection? Our coach can tell us that. See how his uniform is different from the coach in our general rickettsia video? This coach looks more like a general or military man with his hat. He's also trying to coach a boot camp. And this should make you think of a military camp, and especially think of POW camps. The close contact between soldiers or prisoners with poor hygiene allows for the arthropod vector to spread from human to human and can easily cause an epidemic. And speaking of arthropod, what kind of bug spreads prowazeki? If you look a little closer at our footballs being thrown around, you can see that there's something off about them. Yep, they're throwing around giant lice. It's important to remember which arthropod spreads which rickettsia, and not to confuse them. So if you remember the football is shaped like a big fat louse, you'll associate our pro football prowazeki with a louse. A detail of transmission that may be helpful to know is that the louse, which feasts on blood, usually defecates near feeding sites, and it's the scratching that the patient does that introduces the rickettsia into their blood. Okay, now let's talk about some of the symptoms of prowazeki infection and what the disease process is called. First, let's look at this play that the football coach is pointing out. We'll also call this play the outbreak, and this is because the illness caused by prowazeki is called typhus, and specifically it's epidemic typhus. This is in contrast to rickettsia typhi, which causes endemic typhus. Endemic means that it's a disease localized to a region that doesn't necessarily comment on the magnitude of population getting the illness, whereas epidemic is a widespread, rampant outbreak, hence the play name. Okay, now let's go into more of the symptoms of typhus other than the rash. And we can actually think of all of these symptoms when we think about a tackle. First, getting tackled rocks your body, so it causes myalgia and arthralgia. And we've also drawn this player kicking up dirt while tackling. And the player he's hitting is coughing from the dirt or getting the wind knocked out of him. And this should make you think of pneumonia. So we have myalgia, arthralgia, and pneumonia. Finally, a really bad hit in the head can cause trauma. And look at this guy, sitting here all confused. He's going to help you think of encephalitis, with dizziness and confusion. And if it's really serious, both tackles and prowazeki can cause coma in a patient. So that's all of the symptoms. And that wraps up our talk about prowazeki.